Thank you, John. Thank you, fellow panelists, Madam Claire, Madam Nova, Mr. Rajiv, and my friend Steve, and also I see Mr. Robinson, a close friend of mine. And then there may be very, very committed activists compared to all of us because we are doing our bit. I come from India, where I work with a forum called Parliamentarians Forum on HIV/AIDS, and let me congratulate the AFPPD for bringing us all here. And I'm sure we have a strong presence in India of AFPPD. My close friend, Mr. Kurian, heads that, and we still interact on how we share. We always in our forum, we read the AFPPD journal and then the activities. Friends, this is a very important topic, the 3 zeros. Zero discrimination, zero infection, and then zero death. Then how do we, as members of parliament, how do we contribute? As I was telling, our parliament had a 10-year, for the last 10 years, this forum is working. What we do, we sensitize, organize, and mobilize parliamentarians because it's an all-party forum. One single largest party heads, the other party, will be co-chairman, and we have at least 60 members working. 20 would be the core group. And then we sensitize, we have, 1.2 billion population with 28 provinces. We have a provincial government at the states, at the provinces, and we have legislators. We also have 12 legislators fora in place. Our aim is to work through the legislators, and we have 608 districts ranging from 3 million to 6 million population each district. So we want to sensitize the district level functionaries, and ultimately at the village level, we have 3 million village panchayats and 1.5 are women members. They will be heading the panchayats. So our aim is to get this HIV, AIDS, and then maternity, child care issues, the core issues, to the grassroots level, and must be part of the village level planning. So that's the aim of the legislators forum, parliamentarians forum. We have been working. And then I don't want to take more time. We are not only conducting workshops, and then we also demand for more allocation in the budget. And we, at the center, at the federal level, and at the provincial level, the forum members would it's like caucus. We would be in the various committees. I myself was in the Public Accounts Committee. I was in the Standing Committee on the Health for some time. So we make our presence felt during the decisions taken. And the third thing is, we also are pressing for quick enactment of the HIV/AIDS bill, which is very important because that takes care of the second zero, that is zero infection, or the human rights point, the zero discrimination. The HIV bill in India is about to be enacted. It is introduced in the upper house, the Senate, the Rajya Sabha. We have a bicameral legislative body. We have a Lok Sabha, the lower house, and the upper house, Rajya Sabha. It's introduced in the Rajya Sabha in February 2004. But you may ask why it is taking 10 years. Because I tell you, India is a country with huge variations. We have so many religions. We have at least 6-7 major religions. We have 1.2 billion population. We have different communities, caste, and then regional variations. And we have highest number of Muslims next to Indonesia. I think when a social legislation of this sort is to be enacted, we need to consult. We have an active press and an active civil society organizations. There's consultations. We need to have a consensus to build to bring such legislation, because we have interventions at the various judicial levels. So we don't want anything of that sort, and we have to ensure that all the provisions are compulsorily adhered to. That's why the major, the significant steps that would be introduced in the bill is, or that it aims to reduce stigma and discrimination in private and public sector, which is very, very rampant, because the private sector, the moment you get to know that there is some infection, they find so many ways to dismiss that guy or that lady. And the private sector, it's a public sector also, there's a lot of discrimination at the workplace. So we want to address that very serious discrimination. And also it aims to ensure that HIV status does not influence the right to education. You see, we have a right-based approach in India. We have enacted right to education, we have enacted a right to information, we have enacted a law providing a right to forest-based products for the indigenous tribes. We have also enacted a right to work. People should not suffer lack of work. And we have enacted what is called the right to food. We at subsidized rates. And we are going to enact what is called right to universal health. So as a part of it, and this bill is a separate bill, it ensures that HIV status does not influence the right to education, right to employment, right to health care, and right to insurance. Similarly, it also prohibits HIV testing as a prerequisite for employment. This is a very vital aspect of the bill. And day before yesterday, and we had a preliminary discussions before coming to this convention, we thought at least 15, 20 MPs have reviewed the status of the bill and where it is pending. And also, it provides for a grievance redressal mechanism, and also it enhances access to social welfare schemes and health care for people living with HIV/AIDS. Special health care, we have increased our testing centers. See, we have so many special benefits for the poorest of the poor, like free ration, free food grains. So we want that to be free transport. So we want to be incorporated in the bill. Those benefits which are given to the poorest of the poor should be given to the people living with HIV/AIDS. And also, it places emphasis on pre-existing aspects of the program, such as informed consent for testing and treatment, confidentiality of information, access to treatment and prevention of HIV amongst the most risk population. See, this access to treatment in India, we have really concentrating. See, for the last 15 years, in the 4-phase national response to HIV/AIDS, in the initial years, we were, concentrating on propaganda, prevention. Then the final stages, we have concentrated. Now, emphasis is on treatment, first line, second line, and then preventing. I'm sure you will appreciate that India is one country where the new infections have dropped below 60%. So 60% we are able to prevent the new infection. That's one good thing we have achieved, because all of us, we speak at various levels. The people's representative in India have a very, very vital role in administrating various beneficial schemes, the house construction, the land administration, and various benefits like licenses, etc., or at the behest of the local representative or the member of the parliament. Member of parliament has the 2 million grant. He can give it to wherever he likes. There is a gap between the developmental programs. Suppose a 10 million work is there. There is some gap. So the local administration or the people will ask the member of parliament to contribute little, so that the gap filling is done. So I think a member of parliament yields a lot of influence over the population. Similarly, each member has at least 2 million population is elected by, the member of parliament is elected by 2 million population. Similarly, at the provincial level, 0.2 million people are electing one legislator. That's why he interacts with day in and day out. We have an innate advantage in trying to influence the people, and then he will be a key factor. I think sensitizing the parliamentarians, sensitizing the legislators, sensitizing the Jilla Parishad presidents, and sensitizing the village level panchayat elected representatives will go a long way in adding to the administration's effort to achieve this 000. And similarly, the bill has provision for benefiting the children who are affected, orphaned by HIV/AIDS. For instance, safeguarding property of HIV-affected children, recognizing guardianship of older siblings for admission into educational institutions, managing property, then operating bank account, etc. I think series of provisions will go a long way in achieving the second zero discrimination and ensuring the human rights. Similarly, we have a provision in the bill for service providers indulging in stigma in discrimination. Penal provisions. I think penal provisions are very important because there is a grievance mechanism. Any person can complain, and then of course with the proof, and then there are penal provisions ranging from the 2-year to 10-year imprisonment. This is a very, very ideal bill carved out after a lot of discussions with the lawyers collective, a body which is advising the forum and the government on how to bring this law, which is going to be, it's a country, as I said, with various beliefs, various customs, various traditions, and then we were discussing informally the early marriage, the violence against girls, violence and women. We are bringing series of legislations to empower the underprivileged, to empower the women and the children, so that this is part of the entire thing. I think this is what I would like to present. We are trying our best in India through public representatives to achieve this 000. Any questions, I am free to answer. Thank you very much.